Welcome to Plastic Review. We're going to go through the latest papers on minimally invasive procedures in aesthetic medicine for the month of March. The first paper is an Asian paper from China. Actually, it also has authors from Germany and California, and it deals with the targeted restoration of the facial fat compartment volume around the mid-face. The paper is superbly illustrated. Actually, it made the cover of PRS this month with its illustration, and it's a very well carried out anatomic cadaver study as well. The conclusions are, of course, that fat grafting works around the mid-face and that it provides an improvement in facial contours. I am not sure if this is because, or of course the paper does not and is not able, just from the study or the way the study is performed, to prove that placing this fat in the proposed way by the authors is the reason of their results, and I'm not sure if any fat grafting around the mid-face, independently of the facial compartments described in their study or in other studies such as the ones performed by Rodrorick and colleagues, do provide an advantage over just fat grafting around the areas that visually seem to need it most. The next paper is an anatomic study performed by authors from Korea and Thailand, and it deals with the anatomy of the supratrochlear and supraorbital arteries as it relates to forehead augmentation, in order to avoid injury when using filler injection. And although they provide a very useful description of the anatomic variations of these arteries in this region, I believe that overall the emphasis should be placed on general maneuvers that should avoid embolization of these arteries, such as avoidance of sharp needles and only use blunt needles for augmentation when close to these anatomic sites, the use of a retrograde injection technique, and of course the use of low pressure injection, which means basically to use nothing more than 1 cc syringes to avoid high pressure when injecting these fillers. Now, the next 3 papers are on the experimental section of PRS, but undoubtedly they are very, very interesting and have a very important clinical implication. The first one is on the role of bacterial biofilm in adverse soft tissue filler reactions. It is signed by Anand Diva and colleagues of the very active Australian group on biofilm in regards to capsular contracture. And they have come up with a very interesting study, both clinical and experimental. They studied the in vitro capacity of 3 common resorbable fillers to sustain bacterial growth, and all of these fillers did sustain bacterial growth even in the absence of nutrients. They make an important point that patients are 10,000 times more at risk of having an infection of this material with a multi-pass technique. And they studied 5 patients with clinically adverse reactions to their filler injections performed 5 years earlier. They showed that all of these 5 patients had biofilm detected in their filler material. The discussion of this paper performed by John Hunter is also very interesting because it points out how there is a craze for filler injection, and these injections are performed by many professionals, many of them not even related to the medical field, and the places where many patients receive filler injections oftentimes do not meet the necessary sterile or hygienic environment necessary. So certainly something to keep into account, the importance of maintaining a sterile environment when applying these injections. The next paper is a study from the Czech Republic on a comprehensive in vitro comparison of preparation techniques for fat grafting. Now, they compare the three most common techniques of fat preparation, which are decantation, membrane-based filtration, and centrifugation, and they come to the conclusion that they are all very valid techniques for fat preparation. I believe the discussion is very interesting. It is performed by Buchanan and Katz, and they put an emphasis on that there are many factors that influence graft take on fat grafting procedure. And although graft preparation is one of them, certainly it shouldn't be considered the most important factor for volume maintenance after a fat grafting procedure. They do a very nice analogy with skin grafting, where they comment that you can take skin graft with an electrical dermatome or a normal blade or manually. And of course, there are other factors such as the quality of the graft bed or the way you place the skin graft, which have much more importance on your final outcome. But definitely a very important paper by these Czech authors confirming that there are several methods to prepare your fat grafting, and all are very good options for achieving good final results. Now, the next paper I believe is fascinating is by Remy Foissac and colleagues from Nice, France. And they have studied the molecular profile of fat originating from different anatomic areas, identifying which one is the most similar to breast fat tissue. They have found out that breast and chin fat have the same neuroectodermal origin because they express PAX3, while fat from the thighs and knee have a high expression of the gene HOXC10, which has been related actually with breast cancer. The authors theorized that perhaps it's not a good idea to fat graft to the breast tissue from the thighs and knees, perhaps discouraging fat grafting from these areas to the breast. The discussion is very well carried out by Paul Soderna and colleagues from Ann Arbor, and they do stress the safety of fat grafting to the breast at this moment through several studies performed not only for breast augmentation but also for breast reconstruction. I think this is a fascinating topic. The genetic signature of fat, depending on what areas of the body the fat is harvested from, and certainly it's a fascinating topic. And finally, there's a very interesting Viewpoint article by Korean authors Nan-ho Kim and colleagues regarding the use of botulinum toxin in the lower third of the face with what they call the 24-hour principle. They propose this method to identify patients with different patterns of smile in order to better treat the gummy smile deformity with Botox. And moving on to ASJ, there's a very interesting paper by James Innes from Cleveland Clinic and colleagues in which they perform a systematic review regarding the clinical efficacy of platelet-rich plasma in aesthetic surgery. This paper is a must-read for those that performed PRP treatments, and it really emphasizes the lack of scientific rigor in the present studies on the use of PRP in aesthetic surgery. The authors propose different parameters that should be described and measured to increase objectiveness in future studies regarding the utility of PRP. All of these parameters synthesized in an acronym which is FIT-PAW. So certainly a very interesting read if you're involved in PRP treatments. And that's all for this month of March on minimally invasive procedures and aesthetic medicine. I hope to see you next month on Plastic Art Review. Thank you very much.